we're getting to rotations and we have no idea how to actually see a patient. Like we've learned so much information, but we don't know how to actually use that and like diagnose and treat a patient.
I haven't at least experienced any other like third-party resources like this where you are like actively learning and improving your clinical reasoning.
I can't think of any platforms that I've used that provided me with that specific type of learning.
Like I thoroughly enjoyed doing Sketchy this morning. I did it twice because I liked it so much.
I just remember feeling like a lot of nervousness about going into those patient interactions and would have loved to have something like this where I could have just tried out what questions to ask, thinking through like what way you want to say things and like what order to structure your interview in.
It was definitely very similar to what I've experienced like in the emergency department. Attendings will like give you the EKG and just say, interpret this.
I really enjoy it. I think 100% the DDX comes out, I will definitely be a user of it. Or so I start rotations on Monday and I actually start with internal medicine. So a really difficult one like was actually using this DDX case to actually like study. Probably my first day I'm going to see a patient with something like this. So
I was hoping for more practice cases because I would probably utilize this throughout my entire trimester, just help me reach my goal of becoming a doctor one day.